New at 4 in today's Community Focus, your kids may be heading back to school as soon as next week. So how do you keep them as healthy as possible? Joining me now to talk about that is Dr. Carla Martin from the Rhode Island Department of Health. Thanks so much for being here.
Thank you for having me.
So we were just talking in commercial break how it's hard to believe that summer is winding down and the kids are heading back to school. And for many of us, that might mean switching our alarm clocks to wake us up a little bit earlier. So in terms of sleep, how do we adjust our schedules and how do we make sure we're getting enough rest for ourselves and our kids?
So first of all, I would suggest now, before school actually starts, getting your kids back on a regular schedule. So a set bedtime and a set wake time. And a good guideline for kids is elementary school kids need about 10 to 12 hours of sleep a night, of restful sleep a night, and older kids, middle and high school, need about 8 to 10 hours. And the rest of us, 18 and up, need about 7 hours.
Okay.
So really start setting those bedtimes, and that includes on the weekends, trying to keep the same times on the weekends.
So oversleeping on the weekends, probably not a good idea?
It's not, I mean, everyone always thinks there's catch-up sleep, but your body will be, overall will be better for your body if you just keep to your schedule and your regular sleep times. Keep
to that routine. And we'll be diving more into sleep and sleep health next week during our back to school coverage. I'll be talking with a sleep expert about that. Just as important as sleep, what we nourish our body with, healthy food. How do we make sure that our kids are having healthy snacks, especially if we're rushing around getting them from school to soccer practice to ballet class? How do we keep them on track?
So it's good to plan ahead, especially because we want to avoid a lot of processed foods. We want to have more whole foods, such as fruits and vegetables, whole grains. Also cutting down sugary beverages, which I think we're all at fault of that, but really cutting that down and focusing more on drinking water. So a little bit of prep will go a long way in terms of packing your kids' lunchbox and talking to them about choices they make at school when they're in the cafeteria. So that's super important.
My colleague Shannon Heggie is going to be diving into the topic of vaccines a little bit more in depth, as I mentioned, during our back to school coverage, which kicks off next week. I feel like vaccines have been in the headlines an awful lot, and we've just recently learned that the American Academy of Pediatrics has differing advice on the COVID vaccine from the CDC. What should parents know about the shots that their kids need as they head back to the classroom?
Those are great questions. The Rhode Island Department of Health is recommending, in terms of the COVID vaccine, we are still recommending pregnant women get vaccinated. That protects them, they're at higher risk, and it protects their babies. And we're recommending all children ages 6 months and up get a COVID vaccine, especially for children that are higher risk. So chronic diseases, which include obesity, in kids who are in long-term care facilities. It's really important, especially if you have a chronic disease or if you live with someone who's at higher risk of severe COVID disease. And then the other recommendations remain the same, really. So if you have a kid, especially a kid going into kindergarten, into 7th, 8th, 9th grade or senior year or starting college, there are certain vaccines your child may need. And the best thing is to see your pediatrician. And for people that don't have a pediatrician or a primary care doctor, the Department of Health could help hook people up with vaccination clinics. I
know you have a lot of information on your website, and we have a lot of resources on ours as well. Dr. Carla Martin, we're out of time, but thanks so much for being here.
Thank you so much.